Today we are going to be looking at the sectional anatomy of the abdomen, upper abdomen to be precise. And we are going to focus more on the axial images and the sagittals. We look at a few coronals because they are, we look at the ones that apply, but mostly in abdomen we use axial and coronal images. So if we looked at an overview of abdomen, this is the abdomen there. The red inside this rib cage that appears in cream. The red there is the diaphragm. This is the right hemidiaphragm, left hemidiaphragm, and below the rib cage we have the liver, and then on this side you have your stomach there. Those are the most anterior organs below the anterior abdominal wall. Then we have the gallbladder there behind the liver. If we were to remove both the liver and the stomach, what you'd see your pancreas there, and this is the orientation of the pancreas in the abdomen. This is the head. We have the neck here, body, and then the tail. The tail is towards the splenic hilum. This organ here that looks like a moon or a half moon. This is your spleen, and then this is the splenic hilum. The zigzag vessel you're seeing there is the splenic artery, which is a branch of the celiac trunk. We'll get to the abdominal vessels after this lecture. Then we have the portal venous system. This is the main portal vein, right and left. As you can see, the branch of the right portal vein is lower compared to the right of the branch of the left portal vein. Then this, remember the liver has been removed, so this blue system is the systemic venous system, and these three here are the right, middle, and left hepatic veins. And then down here, where we have formation of the IVC, this is the inferior vena cava, this tubular structure here. It's formed by the union of the common iliac veins. These are branches of the renal arteries there, obscured. And then this here is the superior mesenteric vein, this is the superior mesenteric artery, and behind it we have the abdominal aorta. Then the white structure behind there is the spine. And then these are the transverse processes. Again, this is your diaphragm, the red. This is the left hemidiaphragm, this is the right hemidiaphragm. So if we were to remove still the pancreas and spleen, and then the most posterior organs, there we have in the retroperitoneum, you have these kidneys here. This is the right kidney, left kidney, and they are draining and supplying vessels. The ones most anterior in blue are tributaries of the IVC. This is the right renal vein, left renal vein, and then behind them, those are the arteries, respective arteries. So here we have the renal artery, and then here we have the left renal artery behind the left renal vein. Kidneys form urine, and then that urine is brought down by the ureters, these white structures, tubular structures on either side of the great vessels. Those are the ureters. Now, on routine ultrasound, the ureters are not imaged. So, because they're not imaged, we won't be talking about them unless they are filled with fluid, in which case the fluid helps to outline them and we are able to see them. So we won't be talking about the normal ureters, except when we have hydroureters. That is when they are filled with urine and a bit easier to see. Then we have, let me see. Then we have the abdominal aorta there, lying on top of the spine or slightly to the left, and its branches, the celiac axis or the celiac artery, which has two branches, major branches, the common hepatic and the splenic artery. Then we have a smaller branch here. Then we have superior mesenteric artery, and then down here at around the L4, we have its bifurcation L into the left and right common iliacs, one on the right, one on the left. Then this is your IVC, I've already talked about it, and then you have your diaphragm there. The diaphragm separates the thoracic cavity from the abdominal cavity. Then, of course, the white in this image is representing bone. So you have the ribs posteriorly, spine there, then you have the bones of the pelvis. Okay, so we are going to look at sagittal images first. If you still remember our orientation, any plane that is parallel to the midline is a sagittal image. If you turn your probe through 90 degrees to this side, anti-clockwise, all the images that are parallel or that are parallel to that plane would be axial images, regardless of where the probe is, whether it's up here, down here, or on the sides. If you leave your probe in this orientation along the midline or the long axis of the body, and you shift it or slide it towards the lateral aspect of the body, whether on this side or on the other side, what you are carrying are coronal images. That's the orientation. So we are going to go through sample images just to mentally prepare ourselves and to orient ourselves on how the abdominal organs are arranged in the body, and then we'll go on to look at their appearance on ultrasound. So we are going to take a sample from 7 sections, starting from this side, from the right to the left. So we have this cadaveric image, and then on this image, this is on the extreme right. This here, this thin line here, is the diaphragm separating the thoracic cavity from the abdominal cavity below. This is where the head is, and this is where the feet are. This is anterior, this is posterior. So in this image, this is muscles of the back. This is the lateral edge of the right kidney. Here you have the ascending colon on the liver, and a bit of the gallbladder peeping. Then the yellow here is mesenteric fat. These are muscles of the anterior abdominal wall, and this is subcutaneous fat, then skin on the other side. If we go to the second section, this is the kidney now appearing a bit more. And on the previous image, we were looking at the lateral edge. Now we can see the kidney beginning to appear. And then we have the psoas muscle here that gives the kidney this orientation. You have the lower pole, upper pole of the kidney. So the lower pole is pushed away from the posterior aspect by the psoas. So it lies more anterior than the upper pole. And the upper pole appears deeper, just like you see. And then here you have your liver. This is the dome of the diaphragm. So this is thoracic cavity above, and below this is your abdominal cavity. Then this is your ascending colon, and then this is small bowel, and fat in between is mesenteric fat. These are muscles of the anterior abdominal wall, rectus abdominis, transversus, etc. And then you have here the subcutaneous fat and skin on this side and this side. So we are continuing towards the midline. At this stage, we are beginning to see the spine. These are the muscles of the back. And here we have your IVC, inferior vena cava, emptying into the heart. You can see that your liver tissue is getting smaller. This is pancreatic head beginning to show. Remember, we are at the midline, but slightly to the right. And we are seeing the head of the pancreas here. It's the widest portion of the pancreas. Then we have mesenteric fat superimposed. This is transverse colon, a bunch of small bowel loops, as you can see. Then we have muscles of the anterior abdominal wall. Here we are looking at the subcutaneous fat, skin, and the depression of the umbilicus beginning to show. Then we come to the midline, or slightly to the left of the midline. In this image, you can see your spine more clearly, and you can see this is your